Hi everyone, my name is Rebecca and we're going to discuss tracheostomy care and suctioning in this presentation. As with all nursing care, you're going to begin by verifying the patient name and date of birth. After verifying the patient, position the patient in semi-Fowlers, which will promote lung expansion and increases oxygenation. Perform a respiratory assessment, including respiratory rate, depth, rhythm, breath sounds, color, and pulse oximetry. Assess signs that indicate the need for suctioning, which are restlessness, cyanosis, labored respirations, decreased O2 stat, increased respiratory rate, and increased heart rate, visible secretions in the airway, increases in peak pressures on the ventilator, decreasing O2 stat, partial pressure of O2, adventitious breath sounds during auscultation. So you've heard sounds of rhonchi in the lower lobes of the lungs and determine the need for suctioning. Drape a towel or absorbent pad over the patient's chest area. So now you can gather your supplies, which include a suction kit, normal saline supplies, and prepare the suction machine. You can turn on the wall suctioning or a portable suction machine to at least 120 millimeters of mercury and no more than 150 millimeters of mercury. Test it to ensure that it's working before you insert the catheter. Grab an extra pair of sterile gloves because it's always better to have extra supplies on hand. Using the appropriate pressure prevents tissue trauma and ensures successful suctioning. Higher pressures can cause hypoxemia, tissue trauma, atelectasis, and do not necessarily improve removal of the secretions. Before donning sterile gloves, ensure the bedside table is positioned appropriately. Be sure the surface is dry and clean. Hyperoxygenate the patient before starting the suctioning procedure. You're going to prepare by opening the suctioning kit. Now you can take out the disposable container for the sterile normal saline. You don't need sterile gloves at this point. Just be sure you don't touch anything else in the suction kit when you grab the container for your normal saline. Next, you're going to fill the container with the normal saline. Again, be sure not to touch anything else and make sure you don't splash your normal saline anywhere on your sterile field. Once you've taken out the container, just flip over the kit to obtain the rest of the supplies. Open the kit and obtain the sterile gloves. Don sterile gloves using a standard sterile procedure. This picture just shows standard sterile glove procedure. This should all be pretty routine for you guys now at this point. But again, just making sure that you use your sterile technique to don the sterile gloves. So once you've got your sterile gloves on, be sure to keep your hands at mid-level and don't touch anything else. At this point, you can consider your dominant hand sterile and your non-dominant hand unsterile. So you're going to pick up the suction catheter with your dominant hand, sterile dominant hand, and the dominant hand will have the end that is going into the patient's trach. The non-dominant hand will have the suction piece. So use your non-dominant hand to plug in the suction hose. Do not touch the connection tubing with your sterile hand, dominant sterile hand. So put the tip of the suction catheter into the sterile container of normal saline solution and suction a small amount through the suction catheter. Using your dominant hand, gently but quickly insert the catheter into the trach tube. Advance the suction catheter with suction off, aiming it downward and being careful not to force the catheter. Apply suction by placing your finger over the suction control port of the suction catheter. Only apply suction while you withdraw the catheter. Rotate the catheter by rolling it in between your thumb and forefingers as you remove it. Insert no further than the carina trachea, which is at the ridge of the lower end of the trachea that separates the openings of the main stem bronchi. Do not insert more than 6 inches and do not force against any resistance. Forcing the catheter can cause tissue trauma. Obtain more normal saline solution. Repeat suctioning as needed, 2 to 3 passes at minimum for no longer than 15 seconds each pass. Allow at least 30-second intervals between suctioning and hyperoxygenate the patient between each pass. Limit total suctioning to 5 minutes. So after you have completed your suctioning, replace the oxygen source if it was removed during suctioning. Coil the suction catheter in your dominant hand or wrap it around your dominant hand. Pull off the sterile glove over the coiled catheter. Discard the glove containing the catheter in a fluid-resistant receptacle per facility protocol. And then perform hand hygiene and obtain clean gloves. Using non-dominant hand, clear the connecting tubing of secretions by placing the tip into the container of sterile saline. Turn off the suctioning units, reposition patient to a comfortable position, and you have completed your suctioning procedure.